Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. It's a 30-minute daily update on the coronavirus pandemic in Nigeria and across the world. First, some of the highlights. Today, global anxiety is confirmed. Coronavirus cases around the world nears 1.5 million mark. More confirmed cases of COVID-19. Nigeria records 276. We have more states releasing palliatives to cushion the effect of the lockdown measures. Now, it started with just one case in Wuhan, China. Now, the COVID-19 cases globally is nearing 1.5 million, while the data from the World Health Organization puts it at over 1.3 million people. Johns Hopkins University Coronavirus Resource Center figures show that it is nearing 1.5 million. Here in Nigeria, figures from the Nigeria Center for Disease Control, NCDC, says the number of COVID-19 cases in the country is now 276. As at yesterday, there were 22 new cases, 15 in Lagos, 4 in the Federal Capital Territory, 2 in Bauchi and 1 in Edo State. A breakdown of the cases in each of the states indicates that Lagos has 145 cases, the FCT Abuja 54, Osun has 20 cases, Edo State has 12, Oyo 11, Bauchi has 8 cases, Akwa Ibom and Kaduna 5 each, 4 in Ogun State, while Enugu, Ekiti, Kwara and Rivers states have 2 cases each, with Ondo, Benue, Katsina and Delta states recording 1 case each. Oniko Isolation Center is now ready for use following the commissioning by the Lagos State Governor, Babajide Sanwo-Olu. The governor and his team later went on a tour of the 110-bed facility, where he said government will continue to provide the relevant support to the health sector to facilitate the fight on COVID-19. Lagos State was the first state to set up an isolation center at the Infectious Diseases Hospital in Yaba, Lagos.
We want to formally and officially also declare open this Onikon Isolation Center that was built, funded, equipped, everything from beginning to scratch, Guaranty Trust Bank with and in collaboration with Lagos State Government. And I'm hoping that this facility will help us put to best use, but more importantly, will help us to very quickly put to an end the current pandemic we have, which is the COVID-19, very, very soon. Thank you very much. Very
Well, this is day 11 of the lockdown directive by the president in Lagos, Ogun, and in the Federal Capital Territory. Our correspondent, Friday Kirigbe, is at the FCT, joins us now. Friday, let's look at the COVID-19 figures in the Federal Capital Territory, 54 at this time. How much of social distancing do you think residents are engaging in to ensure that the disease doesn't spread?
Thank you, Millicent. Welcome to Abuja. It is really true that we're already in the 11th day of the lockdown, but I must say that many residents here are actually not accepting or abiding by the social distancing recommendation. There are a lot of people, especially in the satellite towns, that are actually not paying attention to that recommendation at all. They live life as if nothing is actually happening. Even though the first few days of the lockdown, we saw a bit of compliance, we will come to see in the few last days, yesterday, today, we've seen a lot of persons turning out in the streets. And even those who choose to stay at home, they're actually taking the stay-at-home order as if it's a public holiday. We see people on the streets, some doing exercise, not having in mind the need to keep that social distancing, which is actually one of the key reasons why the federal government gave the lockdown order for it to be able to effectively control the spread of this disease. So overall, we can say that there is no total compliance as we speak now. Many persons are beginning to see it as business as usual, not paying attention at all to the social distancing.
Friday, we also know that several states are taking different measures, border control measures, that is. And we heard something about the border with Nasarawa State where there have been many arrests. Can you confirm this?
Yes, there is a deployment of security officials to some of the entry points to the city capital, the nation's capital, Abuja. And just the Nasarawa State you mentioned is just one of those entry points. And the way Abuja is actually constructed is such a city that many people who work in the city center actually live in the suburb, like those who live in Nasarawa, which is a very close estate. They come in through that exit. And security men have actually been working on that exit to ensure that some persons that are coming in are deprived. They are not allowed to come in. It's not really an issue of arresting them and taking them to the police station, but they are not allowed to come in. So they are deprived. Some of them are made to stay there, and some are made to return to where they are coming from. So this is the situation as we speak, because many of them would love to come to the city center where they have perhaps they have their shops, especially those who are not on any payroll, those who depend on their daily income, some of them who sell in markets, but they do not sell some of these essential commodities like food, which there is an exemption to. Some of them would like to come into the city center to do their daily business, but of course, the lockdown does not allow for that. And there is need for the security agencies to stop such people. And that is exactly what they are doing at those boundaries.
All right, many thanks. Friday Okerigwe there, our correspondent in the Federal Capital Territory. We'll catch up with you a little later on. Now, allocation of trading areas for traders relocated from markets to school grounds has commenced in Benin City, the Edo State capital. The measure is part of the steps the state government is taking to promote social distancing to curb the spread of the virus.
We are giving them a spaced distance of 3 steps from each other to enforce the social distance. If not, there's no reason for them to come from the regular market. So we have tried settling them down now, to have space of stores, which is one by a peg. Then 3 steps after you get the other. We have gotten 101 now, which I try to put to settle down here. The people you are seeing outside, they are the people that did not get in here because there were more than 500 here. We select the random people here to get 110. If we are getting 5 gari, we are getting 5 oil. We are getting 5 meats. We are getting 5 rice and beans. That's how we pick all randomly to get 110, which is settling down here. After finishing settling them down here, because today is the day 1, we'll now go outside to clean the environment. You can see our enforcement team is coming now to clean the environment. We don't want to see anybody standing outside the primary school or says we are a buyer. And once the buyer enter more than 50 or 100, we shut it down. The others will come out before we get other people in.
Well, staying with the various measures of states to curtailing the pandemic spread, let's take you to Abia State, where the state government is assuring more reach for the poor and vulnerable with palliative food supplies. Members of the Abia State Executive Council have donated the sum of 5 million naira to the state's relief fund. The state governor, Ukezi Ikpeazu, thanked the members while appealing to other well-meaning Nigerians to partner to deliver more palliative materials for the people. This, the governor said, is in consideration of a likely extension of the lockdown period by 7 days. In Ogun State, in the spirit of the lockdown and stay-at-home directive, the Southwest Zone of the Police Community Relations Committee provided food and drinks to security operatives who are in the front line of the action in enforcing the federal government's stay-at-home order. The National Vice Chairman Southwest of the Police Community Relations Committee, Mr. Ibrahim Olaniyan, says this has become necessary in view of the need to identify with security officers carrying out the national assignment. While to Cross River State, the governor, Professor Ben Ayade, led a team of political appointees as well as members of the state's COVID-19 response team to the boundary points between Cross River and Akwa Ibom State to personally ensure compliance with the restricted movement order earlier issued to checkmate the spread. Speaking at the Calabar to Head Bridge, a boundary point between the two states, the governor assured that he will stop at nothing until the era of the COVID-19 pandemic is over. Let's dissect some of the issues on the pandemic. Joining us in the studio is Mr. Abdurafiu Adeniji, National President, Association of Nigerian Nurses and Midwives. Thank you for joining us on the program.
Good afternoon.
Tell us, nurses are the frontline soldiers in this pandemic fight. What's been their experience?
Well, first and foremost, a shout out to Nigerian nurses and midwives for being brave, committed, and very sincere with this war of combating COVID-19. It has been a very serious experience. COVID-19 was coming to Nigeria, and everybody was as if COVID-19 comes now, what will be my experience? What will be my contribution? In fact, the federal government of Nigeria was at a point in time saying that we are more than ready for COVID-19, and some people are even joking, saying that please, COVID-19, don't come to Nigeria because we know our leaders are just paying lip services. But for nurses and midwives, who are the pivot of healthcare professionals, their experience in all over the state of the federation, both in the federal teaching hospitals and the state teaching hospitals, and even the primary healthcare, has been a wondrous one, and it's a very challenging one. However, because the training of a nurse or an healthcare professional is that you have to hold your head while others are losing theirs. You will even be have to cover whatever fear you have. Initially, it was panic, fear, and anxiety. But for now, Nigerian nurses and midwives have acclimatized to the issue of the combating COVID-19.
So can we say that they're well equipped to handling the pandemic?
Well, as in skill and experience and dedication, Nigerian nurses are well equipped.
And
but when it
protective.
comes to infrastructure, equipment, tools to work with, we are yet to reach 50% of what is expected. The personal protective equipment, as we are talking, are more in most of the isolation center. And the fight against COVID-19 does not have a boundary from what we have seen now. The case may be showing up at the primary healthcare center. So we have less than 40% of what is supposed to be the equipment, tools, and infrastructure to work with. And this is a very great challenge to the people. Unknowingly to anybody, without laboratory test, there are some cases of asymptomatic COVID-19 who will be coming. A case has unveiled itself in India, that the midwives attended to a pregnant woman. Third day, 72 hours after the delivery, both the mother and the child tested positive to COVID-19. Perchance, anybody that presented with malaria or any form of symptoms may be incubating COVID-19. And we have also seen the situation whereby Nigerians are not even sincere. They come, they know that have contact with somebody who's incubating COVID-19 or is positive. They hide this history, and it's posing challenges. If these are posing challenges, I think we don't need to judge the availability or adequacy of personal protective equipment and other infrastructure to what is happening in most of the isolation center or where people are being treated for COVID-19. It must be judged all over, because COVID-19 can come into this country from any angle. It can be by road, it can be by any form.
Finally, the World Health Organization is saying the world needs 9 million more nurses. And on the average, how many nurses do we have catering to the number of Nigerians?
In the Nigerian circumstances, the WHO recommendation is that we have 40 nurses by 100,000 population. In Nigeria, as we are having for today, we have less than 200 nurses. We have less than 120 midwives. And about 90% of midwives are also general nurses. What we are having as of present is that in a 200 million population, so to say, we need about 800,000 nurses and midwives. But here we are. We don't even have 200,000 nurses. What we have on ground for now is just about 5 nurses to 100,000 population. And this is not even equitably distributed. This is also being hampered by virtue of where the health facilities are and where these nurses are in Nigeria. It is a very gross shortage of 5 nurses per 100,000 population that we have in Nigeria. So it's a very wide gap. And not until when we are committed, every one of us are committed. The government, the philanthropists, missionaries, and everybody that is involved in production of nurses and midwives, can we be able to say we are moving on to meet the at least average? But when we are saying 40 per 100,000, we have 5. This is, you know what percent? That is less than 5% of what we are expected to have on ground.
We'd like to thank you. These are some of the issues we're talking about, considering a pandemic that's hitting us right in the face. Mr. Abdurafiu Adeniji, National President, Association of Nigerian Nurses and Midwives, thank you for joining us on the program.
Thank you so much.
Still to come on our COVID-19 update, almost 90,000 people have died as a result of the pandemic. We have details after now. Welcome back to the program. Now, Bayelsa State is one of the many other states that is yet to record an index case of COVID-19. However, the state government is taking precautionary measures as they have directed partial closure of markets. Our correspondent, Dobra Timiwood, is in Yenagoa and tells us more.
At the moment, Bayelsa State is yet to have any index case of the COVID-19 virus. Notwithstanding, the state government has put measures in place to ensure that the virus is contained if there's ever an outbreak in Bayelsa State. Presently, there's an isolation center at the NDUTH. That is the Niger Delta University Teaching Hospital, but there are no patients. Earlier on, they had patients at the isolation center, but they've all tested negative to the COVID-19 virus, hence they've all been discharged. Now, I spoke with the Director of Public Health in Bayelsa State, and he says they have teams that go out daily to check if there will be any active, patients showing signs, symptoms of the COVID-19 virus in Bayelsa State, but they haven't seen any yet. Now, the call centers are very active, as Bayelsans have been calling, asking for food. That's according to the Director of Public Health. And he says then they've also been presenting other symptoms similar to malaria and other sicknesses, but not of the coronavirus. Now, movement in Bayelsa State is not restricted. People are moving freely. Civil servants from grade level 1 to 12 have been advised to work from home. There's partial closure of the markets in Bayelsa State, allowing only those that sell food and medical supplies to operate. Now, social gatherings, burials, weddings have all been put on hold because only 20 people are permitted to be at a gathering per time. Now, that's what is happening in Bayelsa State regarding the containment of the COVID-19 virus. Dobra Timiwood, Channels Television News.
The latest there from Bayelsa. Well, let's talk some more about the rising cases in Nigeria and government intervention. Joining us in the studio is Dr. Austin Aikpo, a public health physician. Welcome to the program.
Thank you very much.
First, the Chinese medical team, they're here. You're a member of the NMA, and they had reservations against this team coming in from China. Are there still reservations on that issue, seeing as they've arrived?
Yes, despite the fact that they have arrived, our reservations are still there and still very rife. Because you can't go to any country and just start practicing the art of medicine. If we, for example, travel out of this country, we have to do some prescribed training and write examination. And our extant laws also have that. The Medical and Dental Council of Nigeria are supposed to get those people registered to practice. So they're not supposed to just come to the country to practice. Though the government is saying that they are not going to practice, but that they're just bringing technical know-how. So we are still waiting to see how that goes, but we are still very much against the Chinese coming to Nigeria to come and see our patients.
Give us an assessment of how we're handling things, seeing as we're also seeing a rise in cases. Just yesterday, 22 more.
Yes, the problem with the apparent rise is that, not that we're not doing something, and I'm talking about the country, just that we're beginning to increase the testing. Initially, we were not able to test as many people as possible. Now the test kits are readily available, so we're having more cases being tested, and that's why you see this apparent increase in number of cases. But if you look at the deaths have plateaued over time. I've not really had so much death, just 6 as we speak. So we still expect that as more tests are done, we still expect to see more positive cases.
Do you think we're social distancing enough? And would you say that there's merits that everyone should wear masks? We have the Edo State government, Cross River, insisting that that should be compulsory now.
Yeah. Let's look at the social distancing. The Nigerian populace are not doing enough. On my way here, I saw a lot of young men playing football on the roads. You see, I also saw people were lined up outside the supermarket to purchase, and there was no distance between them. What we mean by social distancing is that there should be at least 1 meter between two individuals. But people don't seem to understand the science behind the social distancing. Because the COVID virus, it's a novel virus. It's quite new, and not much is known about it. But it is known that if anybody who has the coronavirus disease, if he or she coughs or sneezes, it releases the virus in the droplets. But you know that droplets take some time to settle. They travel close to 1 meter before they now drop, because they travel in a projectile manner. So when they go, they drop just before 1 meter. And so if you are in the line of that projection of the droplets, and you are not wearing a mask, you are most likely going to get it. But if you stay 1 meter away, they would have dropped on the surfaces before it gets to you. So Nigerians need to really understand that. I also saw on the media the other day where government was distributing the relief materials, and you still struggle to get those materials. So the government is not even helping the situation. They should understand the science behind social distancing. So what we need to do is we try to educate. We need to educate our Nigerians more. We say somebody should give a distance. He doesn't know why he has to keep the distance. And so that's why it's not doing it. On the issue of mask, yes, it's good to wear a mask, but the mask is actually very good for the person who is infected or who has the cough. If we all wear masks, yes. But look at the scenario where I wear a mask, okay, the person who has the COVID unknown is not wearing a mask, and I'm not keeping the social distance.
So that doesn't work.
And he or she coughs. So the eyes are also part of that can get the virus.
We'd like to thank you.
What I'm
we had
saying
more
is that,
time, but briefly.
Yeah, briefly, everybody should wear a mask. It reduces the contamination, especially those who are suspected of having.
We hear the NCDC is yet to come up with that guideline. We look forward to that. We'd like to thank you, Dr. Austin Aikpo, public health physician. Thank you for joining us on the program.
Thank you for having me.
Now, from around the world, they say the pandemic is nearing 1.5 million confirmed cases, and that it has reached every continent except Antarctica. The vast majority of cases and deaths are now outside mainland China, where the outbreak began, with the US and Europe bearing the brunt. And the Nigeria Center for Disease Control's website is live for you each time with several cases, information, statistics on the cases across the country with regular updates, also several guidelines. Don't forget the emergency contacts as well if you need it. Also, live feed coming from the World Health Organization, each update from around the world, the risk assessment of COVID-19. You can take a closer look at some of the numbers in real time. Well, that's our COVID-19 update here on Channels Television. We have another update coming up at 6 p.m. today. Thank you for watching. Stay safe. I'm Millicent Walker.